Përshëndetje të dashur miq, ja ku vim, jemi sot me Televizionin Shqiptarëve të Amerikës këtu në një intervistë posaçërisht për ju, mbi të gjitha për informacionin e përgjithshëm të shëndetit oral. Jemi me doktor Fadi Assaf dhe për më tepër ju do të na ndiqni edhe në intervistën e plot për të gjithë informacionet që doktori ka për të dhënë. Welcome Dr. Fadi Assaf. It's a pleasure to have you today at Albanian TV of USA, of United States of America, here in Troy.
Thank you. It's a pleasure for me to be with you in Albanian TV.
We want to know a little bit more about your professional background as a dentist and what are the services that you provide and where is located, since we have the advertising with you and the Albanian community are so probably willing to come and follow up with the oral care.
Sure. I graduated from dental school from University of Detroit Mercy in '98. And since then, I've been working very hard with the community to deliver good dental care. We do mainly general procedures for dentistry, but my main focus and my main passion is implant dentistry when people are missing teeth. I have two locations, one in Farmington Hills, one in Shelby Township. I have few dentists who are my partner who work with me. And we focus on every aspect of dentistry, from filling to root canal, crown, bridges, braces, implant, denture, and cosmetic dentistry.
Interesting. The locations are very good too, because the Albanian community usually, especially in Shelby Township, is spread all around. So I'm pretty sure whoever doesn't know and follows up with Albanian TV advertising, don't miss out this great doctor.
The thing is that I decided to do is because I started in Farmington Hills on the west side, then I found the need to move to the east side. Now in Farmington, we are open 7 days. Even on Sunday, we have dental coverage for treatment and emergency. In Shelby, we're open 3 days because it's hard to be open 7 days on both locations.
Okay, anyway, not bad, because Farmington is not that far either, so they can both come and visit and do the patient need.
I do agree, yes.
Okay, let's go more into the general information that all the viewers might need to. So how many teeth are in our mouth and what is the role?
The full set of teeth we have as a human is 32 teeth, including wisdom teeth. The main role of the teeth, obviously, is to help us eat, chew, cut the food, and to give us some support for the lips, because without teeth our facial profile will collapse, and we don't want to do that. We look like as we're aging earlier, and also provide cosmetic when we smile. A lot of people end up losing their wisdom teeth because either they're impacted or they come out crooked, so we tend to remove them. So if we're lucky, we keep our teeth, 28 teeth after removing the wisdom teeth.
So wisdom teeth is not always that necessary.
It's not always necessary, no.
And as you mentioned that without teeth we kind of will look ridiculous.
Yes.
Smile is half of the beauty.
Absolutely.
That's a famous statement.
Yes.
When should people start the oral care? What's the specific
Very
age?
good question. I would say 2 to 3 years. Of course, it's going to be hard to brush the teeth with a warm cloth. Just gently massage the gums. And after that, the teeth. It's nice to produce the child to the dentist as early as possible so they have a friendly relationship and they're not scared. And the dentist will probably show them how to brush and use certain friendly terms to kids. And every 6 months thereafter, it's good to see a dentist.
Okay, yeah, that's a good information to know, because sometimes parents might think that they should start later, and that's how they start having a lot of cavities.
No, the earlier, the better.
Okay. With the good care that we might provide ourselves with the oral care and brushing the teeth, doing all the need that they become healthy, why we still have cavities?
Very good question. So let's say someone takes care of their teeth the way we should. Remember, there's always a small component of genetic. However, if we do our part, which includes brushing after every meal, flossing daily, and seeing the dentist every 6 months, the possibility of having cavity is going to be extremely low. The only reason I would say you might have it is if you're sipping on sugary drinks like Coke, Mountain Dew, 7-Up, or if you're genetic, if you're not lucky in that department.
So sugar is the first killer and like
enemy. The biggest enemy to teeth is sugar, simple sugar.
What about the patients that do not follow up with their oral care daily? What are the consequences?
The consequences could be from small to severe. I mean, you could end up having cavities that end up being bigger cavities, root canal, abscess, gum disease, tooth loss. And research recently showed us that there's a big correlation between the bacteria and gum disease and bacteria and heart disease, and then general health. Because remember, all that bacteria is being transferred to the bloodstream, and it sits with us, and we don't know it. So it's extremely important to have healthy gum that doesn't bleed when we floss. And then your dentist that you see every 6 months, he's gonna give you an evaluation, and he's gonna give you his opinion on your oral health. And it's something we take for granted because we think it doesn't hurt. It doesn't mean if it doesn't hurt, there's no problem. Because sometimes cavities, not necessarily, they don't hurt. They sit and they get bigger and bigger, and you're eating a small piece of toast and the tooth will fracture.
So we're not always aware of what's happening.
Correct.
That's why we need to go
every 6
twice
months
per year.
Every 6 month checkup, as you're getting a physical checkup. I mean, by all means, how often do we go to the hairdresser? How often do we do our nails? How often do we take showers? So teeth are extremely important.
They are way more important than all mentioned
I don't know,
above.
but I think they are up there.
I'm pretty sure, for sure, better than doing nails.
Yes.
It's like it's something you're gonna have forever, and like the more you
Just
take
give
care,
us twice a year.
that's it, right?
That's it.
Nails need to be done every month.
That's twice a year. I'm happy.
What are the early cavities symptoms? Since we were
Sensitivity to hot and cold. If you're lucky, you feel that sensitivity, so you could go see your dentist. Sometimes if the cavity gets bigger, it eats away the tooth structure, then the tooth breaks. But if you catch it at an early stage, the solution is simple. A filling, a white composite filling will take care of the problem.
okay, so you don't go into like a broken teeth or
Hopefully it didn't get to that point, because once the tooth break, it means the cavity is bigger and it's
Okay,
gonna
it needs more work.
Maybe a crown.
I agree. So we were mentioning the gum minutes before, and we want to know what is the importance of gums in our mouth.
Look at the gum as the protection and the weapon that we fight bacteria. Gum is extremely important. There's a specialty for gum called periodontists. They work very hard on fixing the gum, repairing the gum, and generating the gum. Without strong gum, our defense system breaks down. The bacteria will attack us and goes to the bloodstream. It's very simple. Floss, see your dentist every 6 months, follow their recommendation, and you're going to be protected for the rest of your life.
Like with like what I'm hearing, gum makes it really dangerous if you like.
It is.
Don't take
It is.
the good care.
It is it's a serious issue if we don't take care of our gum.
How many days we need to brush our teeth and floss our teeth
I
daily?
recommend brushing every meal. Okay. After every meal. But there's a little trick I want to mention. Floss every day if you can. Now, sometimes if we drink anything that is acidic, don't brush right away, because that acid wears the enamel temporarily. So if you go and brush it, you're introducing abrasion, and that's where the teeth a little bit more. Wait about half an hour.
So for example, if it's orange juice,
Yes.
like the vitamin C,
Yes.
like the acid, we have to wait.
Yeah. Use water after that to get the effect out, then brush.
How many times the toothbrush
If I
needs
tell you
to
5
be changed?
minutes, I'm going to be asking too much. If you give me a minute and a half to 2 minutes, I'm good. Just be sure all the plaque is out, all the bacteria is out. Take your time, and extremely important to use the softest toothbrush we can and brush gently. Remember, teeth are very sensitive. They are very fragile because you're doing it every day 2-3 times. It's not a rock. So use gentle movement and soft toothbrush. If you brush really hard, you're gonna wear down the enamel. So be extremely gentle with the teeth and the gum. And aim your toothbrush toward the gum. Now, I'm not gonna be able to give an instruction on how to brush now, but I'm sure your dentist or your hygienist, who are amazing at giving you instruction, will show you how to brush and floss properly.
And is there any specific toothpaste that makes a difference?
Fluoride? No, fluoride. If you're brushing and you're flossing, you won the battle.
I remember back in the days in Albania, we used baking soda. Is that good to like wash the mouth?
I would stay away. Toothpaste, just regular over-the-counter toothpaste, regular soft toothbrush will do the job. Keep it simple.
And is the liquid to wash the mouth and like for the gums, does that help too?
If you have gum disease, maybe there are certain rinses that your dentist will recommend. But if you are healthy and you have healthy gum, you really don't need it, unless if it adds an emotional component for you for a fresh breath.
Well, you already mentioned that we need to see the doctor twice a year, so every 6 months, going to the dentist. What is the importance of dental checkup? Like more details?
Yes. It could be as simple as ensuring you that you're doing a good job, teaching you how to brush and floss, finding out if you have any cavities, fractured teeth, and it's extremely important to do cancer screening, because who's checking if you have any cancer in your mouth? Your dentist. He's gonna check the lips, the tongue, the throat, and a lot of time, even believe it or not, when we take panoramic x-ray, we could see even blockage in your artery. Some technology nowadays will show us if you have any other problems. So checking with the dentist every 6 months will provide a summary for your oral health.
Is anything specific except brushing, flossing, even rinsing when it's necessary, that young generation should do to keep their teeth healthier? What about the diet, the food that we consume?
Avoid sugar, avoid smoking. Smoking really harmful to the gum. It takes away the oxygen, it burns the gum over the years, and it causes oral cancer. So for young generation, I always told my kids, I have 3 young boys, and I tell them, please stay away from smoking. I never smoked in my life, occasionally a cigar, I'm not gonna lie, once in the blue moon. But if you can, please avoid smoking as much as possible. Healthy diet, I mean, even sugar is bad for our health. And if you eat, always brush.
Okay, that's very good to know, because we kind of grown up with the idea twice a day is good, in the morning and at the evening. Great. So, but every meal it's even better. I mean, unless we are at work and then we have to take toothbrush.
Yes. I mean, if you do it 3 times, I mean, you're an incredible individual. I mean, twice would be great.
What are the main reasons we get a tooth decay?
Sugar.
So the worst enemy. It's actually worst enemy for health conditions in general, but
sugar eats away the enamel, eats away the dental, penetrate the tooth, and sets an environment where all the bacteria that eats away that tooth structure is attacking the mouth.
What exactly is the nerve of the tooth? And what kills a tooth nerve?
Good question. Every tooth has nerve. As we go to the back of the teeth, back of the mouth, the molar and the premolar have multiple nerves, multiple sections, because they have multiple roots. So every tooth give us, and the nerve has multiple job. One of them is nutrition of the tooth, sensation. What kills it, again, is the bacteria. Remember how we started talking, if you have a little sensitivity, maybe you have a cavity. If the tooth breaks, it's bigger. Now at one point, the cavity gets so big, it attacks the nerve, and it kills the nerve. And if we don't feel it, it sits an abscess on the end of the tooth, and that abscess starts destroying the bone. not only the tooth. And that's why sometimes you see someone who has a huge facial swelling. It's because of the abscess.
Does it end up with a surgery?
Tooth loss, antibiotic, yeah.
What defines a dental emergency? So when it's like the emergency when
it could be pain, it could be severe pain, it could be a fracture. Your son is riding his bicycle, he fell, he's playing basketball, he got hit. Sometimes if you have a loose bridge, loose tooth, it's definitely a dental emergency. God forbid, apparent loss of denture or broke denture, it's an emergency.
Even about swollen? Like
swelling is definitely an emergency.
If we wake up in the morning, swollen means that's right away emergency.
Absolutely. You will see your dentist right away. If there's facial swelling, it's not only related to the teeth, it's health, because all that bacteria is going to your body.
And you mentioned earlier the service that you provide, and one of them was the dental bridge.
Yes.
So what is the function of dental bridge, and when are those being recommended?
Dental bridge is if you're missing a tooth. We prepare teeth on both sides, make them a little smaller, and we do 3 crowns attached and we cement them. When I finished dental school, I used to do a lot of bridges. Now I stay away from them because I'm cutting virgin teeth to accommodate the tooth that was missing. I much prefer not to touch them and add a dental implant. This way I preserve the teeth and I preserve the bone in the middle.
Is this the newest
it's not
procedure?
New. It's from the 70s,
it's always been?
It's been there for a while. It's not new anymore.
What about the dental crowns? So what are the dental crowns and how permanent is a tooth crown?
Dental crown is if we lose a lot of tooth structure. You have a big filling and then the tooth doesn't have support anymore. We do a crown. Depends on your bite, how strong your bite, genetic, oral hygiene. They could last from 5 to 10 years and you have to replace them.
Okay, so that's like 10 years the max
Maximum.
that they
yeah. I mean, I've seen people who had them for longer, but this is the exception, not the rule.
So it means like all the time whoever has the dental crowns has to replace them.
Yeah.
What are the benefits of tooth implant?
Tooth implant has a lot of benefits. Number 1 is replacing missing teeth. If we have a missing tooth within time, adjacent teeth and opposing teeth will shift because nothing's stopping it. So they come down or they occupy the space. So it will replace it. It will give you better ability to chew. It will maintain your facial structure. And most importantly, you want your full teeth. I don't want people walking around missing teeth. Now, if you have multiple teeth, so the implant would be an amazing tool for us to eat better and look better.
Understand. And how long does the implant surgery take?
If we are healthy and if we are lucky, the implant, the fixture in the bone will last forever. Hopefully the crown will last forever because it's on top of the implant. Sometimes they chip, sometimes they come loose, we replace them. But I had a lot of cases, 10 years at least, and then no problem.
And what is the oral hygiene that the patient with implants should follow?
Exactly the same thing. A 6-month visit to the dentist, floss, brush, take care of the teeth, of the gum. Now, people think if I got an implant, I don't have to see the dentist. You still do because you're going to accumulate some plaque that you cannot remove. Only dental hygienist and dentist could remove it.
Okay, so that's a checkup you guys better not forget, should follow up always twice a year, no matter what. Like what's the oral condition. Even if you have your teeth, your original teeth, or you have implants, you still need to go to the dentist.
Give us twice a year. That's it. That's all I ask.
How many implants are needed to support a bridge?
Good question, but how many teeth are you? If let's say you're missing all your teeth on top or on the bottom, there are some concept between 4 to 6 implants are enough to support your whole arch. But now let's say you're missing 2 teeth. Maybe you need 2 implants. So that's
so it depends
the situation. The more missing teeth you have, the more implant you need to support it.
Okay, and then that probably needs a little bit more time,
yes,
right? To implement all the...
Your decision you have between you and your dentist who's going to do the implant.
Does the health conditions, for example, diabetic people?
Yes, you did your homework, yes. So diabetes is the biggest precaution for me because the body doesn't heal as well. And there are some numbers that we follow. Smoking also play a role, osteoporosis, lack of vitamin D.
But there are heart diseases too?
Not much. Some medication, but not much. But again, these are only risk factor. My mom smokes. I did dental implant. She did fine. Diabetes, I'm concerned about it the most, especially when we talk about the hemoglobin A1C number. We want to check it with your doctors. Sometimes when the patient is taking a blood thinner, I have to have a conversation with their physician to see, can I stop it? Is it dangerous? We always have a conversation with the physician because their health comes first.
Yeah, understandable. When they have other health issues, means that it needs a discussion between the general doctor
Absolutely.
and then the dentist. Let's go a little bit to cosmetics. Since nowadays we see in social media a lot whitening. Is that recommended? I've heard some dentists say no, some say yes, some say they damage. So we want to know your opinion.
Remember, whitening your teeth is like dyeing your hair. It's not permanent. Nothing is permanent unless it's surgically implemented. So if you have a wedding, you have a party, you have an event, whiten lasts a month to 2 months. Depends on how much coffee and wine you drink. Anything that stains your shirt as a liquid stains your teeth. I mean coffee, tea, wine. So if you're thinking you're gonna whiten your teeth and your teeth are gonna be white for the rest of your life, it's not a true statement.
It's a myth.
It's a myth. Is it bad? It's not bad. It's just if you have sensitive teeth, bleach will make them a little bit more sensitive.
So for how long does the whitening usually last? Is it like 3 months?
2-3 months.
And then can you do it right away or you should wait a little bit?
You can. We give the patient, sometimes we do an office whitening and we give them a kit. We say touch up. Whenever you have an event, touch up.
Well, so with the comparison, the bleach for the hair extremely damages the hair. And usually from blonde, the ladies go to being brunette again. So that's why we want to know, keep whitening.
I mean, if you whiten a lot, I would say you are going to cause sensitivity to your teeth.
So it weakens?
Yes, it doesn't weaken, it causes sensitivity. So I wouldn't recommend whitening for the rest of your life. If you have a couple of events, if you want white teeth, consider veneers. Because you just do them, you're done. They're not permanent because every 7, 8, 9, 10 years, depends on how you take care of your teeth, what you eat, you need to replace them.
So all the Hollywood stars and the pop stars we see in the media, they have veneers, right?
Veneers, for sure. Yeah, no one is going to have that result on whitening.
So that's make the $1 million smile?
That's a $1 million smile. It's veneer.
Or unless someone is lucky to have the smile since it's
natural,
born.
which is very hard. Now, if you have pearl white teeth and you do braces, you are lucky. You won in the genetic department. But most of us, we either have yellow teeth or the teeth are not 100% straight. Veneer could be the solution.
Okay, that's good to know. What are some of the greatest tips you will recommend to our viewers who can be the patients in the future?
Establish a good relationship with a dentist. Follow their instruction. Brush daily after every meal. And please floss. Flossing is not that hard. It takes about maybe 1 minute to 2 minutes to floss all your teeth. And then this here will serve you for the rest of your life, and you will set a good example for your kids. For kids and for young people, avoid smoking and avoid sugar, liquid, Pepsi, Mountain Dew. Anything that has high content of sugar, please avoid it.
So, and what about, since we mentioned coffee and wine? Okay, wine is not going to be in a daily basis, but coffee that we drink it's
not bad.
Daily. It's not bad.
It stains the teeth, but it's not bad as long as you're not using too much sugar in it. Like coffee and tea, the only effect is staining, but you could clean it. When you do sugar, the effect is not reversible. You cannot reverse the effect of tooth destruction unless you do a filling. But what's gone is gone.
But what about natural sugar, for example, honey? That might be more healthier.
It's healthier, but still causes cavity.
Well, unfortunately,
even bread, if you don't brush, causes cavity. It's carb.
yeah, and then they still have sugar, even pasta and even bread. The last thing, since we're going toward the end of the interview, and advertising through Albanian TV, and I mentioned earlier in the beginning of this interview, did it help to build a relationship with Albanian community? I know that you already know Albanians, they come and are your patients, you work with Albanians, but like what's going on with like general?
I've been working with the Albanian community for a while. I have a lot of Albanian staff that I consider them as family. I have a lot of Albanian friends, and I really love the culture. It reminds me so much of my culture from the Middle East. It's a very warm, hospitable, and open culture. I get excited when I get Albanian patient to the office because I know a little bit about it, the culture, and my staff directs me certain way, and educates me more about it. So I am very excited, and this is the first time I do an interview on TV because I love the community.
Okay, so we are willing to do more interviews.
I would love that.
And hopefully we're gonna keep touch, and so we build a healthy general information, because knowledge is always
power. Yeah.
Having power. So the more you know, the better you act with yourself, because we have to be the doctors of ourselves first.
100%.
So
100%.
the more we know, and then the more information we transmit,
the better decision we make.
Exactly.
Yeah.
So thank you very much for being here, for the interview, for very good tips that you gave us all this hour that we were together. And I hope to see you soon. Congratulations and good luck.
Thank you. It was a pleasure being with you.
Thank you so much. Të dashur miq, sikur se tham, ishim me Dr. Fadi Assaf. Faleminderit që na ndoqët. Shpresojmë që informacioni të ketë qenë ndihmues për të gjithë ju që keni nevojë të dini më shumë për ndihmën mjekësore në rastet e shëndetit oral. Për sa kohë që me Dr. Fadi Assaf dhe me klinikën e tij dentare kemi dhe reklamën me televizionin e Shqiptarëve të Amerikës, mos hezitoni ta kontaktoni, informacionin do ta gjeni më poshtë të vendosur. Për çfarë do lloj nevoje që keni, stafi është shumë mikpritës, sikurse edhe doktori. I was saying that you are very generous with Albanian community, I'm pretty sure overall with all people that come see you. So they better do not hesitate to come and see and check up on themselves what's going on.
Thank you.
Better early than late.
Absolutely.
Thank you again.
Thank you. Appreciate it.